What are the financial considerations that go into the decision to use an individual Medicare marketplace? A chief financial officer of a major U.S. city shares why her organization made the move.
From Willis Towers Watson, welcome to ION 65, a podcast for public sector employers concerned about retiree healthcare.
I'm Marianne Steger with Willis Towers Watson's ION 65, and today I'm so excited to be joined by Chief Shirley Ford.
Well, good afternoon. I'm Shirley Ford, Chief Financial Officer for the City of Memphis. Thank you, Marianne, for having me here with you.
Now, you and I are sisters in some way because I moved our Medicare retirees from a group Medicare plan to the Individual Medicare Marketplace, and you did the same thing. What were some of the reasons that led the City of Memphis to want to do that?
At the time, we had several things going on simultaneously. One, huge unfunded pension liabilities. And number two, our OPEB liability, which was also creeping ever upward. And in 2013, before we started into some of this process, we were at $1.3 billion in our unfunded OPEB liability.
Wow.
So it's almost such a big number that it doesn't have any impact. You just go, okay, $1.3 billion.
For our listeners, let me remind you, OPEB is other post-employment benefits. It usually is retiree health care, and this is the future cost of this benefit that an employer could be providing. So that's a large number for a city the size of Memphis.
Yes, and our benefits were very rich. They were wonderful, but unfortunately, they were just not sustainable. And it created a financial impact for the city that culminated with this unfunded pension, this unfunded liability, with the recession and the slow recovery. And basically, in 2014, the city found itself in a financial crisis.
Wow.
So part of this was looking at how can we reform some of these very important initiatives and create sustainability and restore some of the stewardship and the financial structure and stability for the city. OPEB was extremely important at that time. I think in 2014, our OPEB cost, the cost incurred because we are self-funded, was $50 million in 1 year. Obviously, the premiums from the retirees was not anywhere near enough to cover that type of cost. The philosophy became that the active employees are paying for the retiree employees. So we were having huge draws from our healthcare plan, huge draws from our general fund plan, just to pay the claims incurred.
So when did the city start looking to move to the individual Medicare marketplace?
We started looking at other models of ways that we could try to contain the cost and still provide a good benefit for the retirees. And the last thing you want to do is pull benefit that they've become reliant upon, but the reality of that is if we didn't do something, we weren't going to have a plan for them to rely upon. So in 2016, we started looking at alternative ways of handling the retiree health care, and along came the individual marketplace solution, which I think was a win-win situation for the city of Memphis.
So you say it was a win-win. Let's talk first about how is it a win for the retirees?
The reality of that became that not only was it expensive for us, it was expensive for our retirees too. Right. So to find a bridge that we could help them find a plan that suited their needs as best we could. The win-win situation is that it became a cost control, cost containment for us, and then it became a situation for our retirees that they actually ended up in some cases with much better coverage than they originally had with the city.
And was it at less cost to them?
Yes, and less cost to the city, which is wonderful. One of the things we did was a health reimbursement arrangement that allowed us to provide some financial support to those retirees that were moving on to the individual plans.
And when doing this, you reduced your OPEB liability by a considerable amount, didn't you?
Yes, we did. From 2013 to 2018, our liability dropped $1 billion.
That's significant.
Our FY18 liability was $333 million. I mean, it's amazing what has happened with the savings that we found through that process, that helped us hit our pension funding. So we're fully funded in our pension 2020 for the first time since 2006. So we kind of did two things simultaneously. We shored up the retiree health care and we helped shore up their pension.
That's an amazing story. And too often we talk just about pension or we talk just about healthcare, but I have always been interested in the linkage between the two, because if your pension isn't well funded, you can't afford to fund a healthcare program. And so if you could make those savings in the healthcare program, then you're able to dedicate more money to your pension fund, and then your pension stabilizes. That sounds like exactly what you experienced.
And that is exactly what we did. And that was the outcome that we saw. Not only that, but we saw a healthier, happier group of retirees. For the first time in 5 years, the city is really on sound financial footing, and we feel like we have a basis to give current employees comfort and confidence that their pension and their OPEB is going to be there when they need it. And we use it also as a recruitment. We're trying to build something that will go beyond my administration and the next administration, we hope.
So you mentioned recruitment. Some of these jobs in the public sector are difficult to fill.
Yes.
Correctional officers, police and fire, even teachers. And so do you find being able to say you have a retiree healthcare program that's affordable and offers this choice, that it helps your recruitment?
Exactly to your point, Marianne, it is very competitive out there right now for public safety. And there are other areas in the city that are likewise very competitive. And how does someone pick the city of Memphis versus one of our sister cities here in Tennessee or somewhere else? And part of that is giving them a program that they can see the sustainability of.
So if I ran into a City of Memphis Medicare retiree, what do you think they would say about their health care to me?
I would think they would say today that they're much happier. I would think that they say they have this white glove service where they can be on the phone with a representative for as long as they need. And with a city where you have limited resources that can do that, to be able to give them a platform where if they need to talk to someone for 30 minutes, that someone has 30 minutes and more to spend with them.
If you had advice to a city that was out there who is struggling with OPEB and the increased costs and thought, well, here I'm hearing this individual Medicare marketplace is more affordable, but that's really big change. What advice would you give them?
This is not an uncommon problem with municipalities, but I think what you have to do is kind of look past those traditional finance and HR roles. They've been so ingrained in many of us for years and years, but you've got to look past that to look at strategic opportunities and how you can fundamentally change a business plan to make it better. And then you have to position yourself financially and structurally to have the agility to move on those things and to implement them. And I think one of the challenges for being in HR and finance and being in an administrative role, for our mayor even, you have to be agile. And you've got to be kind of this co-innovator. And the private sector may have been doing this for a long time, but now we're talking about public sectors that have these ingrained silos sometimes about how we function and how we operate. And I think this gives us an opportunity to be really co-innovators and to collaborate to look at the best ways that we can possibly make this happen for our employees and our retirees.
One more question. After you moved to the individual Medicare marketplace, did you see a reduction in the administrative burden or the work that you had to do in the city?
Yes, it's amazing because, we are self-funded. So when your claims costs go down, the number of claims go down, the number of administrative claims that you're handling, whether that's internally with your staff or externally with your third party. What we have seen is a better collaboration and increased efficiencies and effectiveness of that. And that enables me to take those people who were previously manning those phones and trying to handle those things and put them into other areas that we can talk about, maybe total rewards for an employee and how can we push them into a different area. So I think across the board, you see efficiencies. When we save and when we create efficiencies, it enables us to share in different ways with our employees and our retirees.
I can't thank you enough for taking the time to talk with me today.
This was fun. Thank you very much. I really enjoyed it. Thank you for letting me be a part of this.
Thank you for listening to Ion 65 by Willis Towers Watson, a leading global advisory, broking, and solutions company serving thousands of employers worldwide. For more information on Willis Towers Watson solutions to manage employee risk, optimize benefits, cultivate talent, and expand the power of capital, visit us at willistowerswatson.com. You can find more episodes of Ion 65 on iTunes. Share with your colleagues with hashtag Ion65. That's EYEON 65. Join us next time